my daughter, oh, her daughter's so cute. My daughter has cavities between her teeth. They gave me prescription for Vicodin, and we're going to use nitrous oxide and fill on 2 different days. I am super nervous. Is there benefit / harm to waiting? Are both drugs necessary? And. Now, we just should probably say, if we're really concerned about your kids, this isn't a substitute for actually seeing a dentist. This is, there's no legal responsibility on her she's just giving advice, and this is a free thing, but she's happy to give her thoughts on it.
Right. So, and I don't know all the situations involved.
Yeah.
So do you want to know, do we need to do, first of all, let me tell you, calm down. We're going to be okay.
Calm down, Heather.
If you are nervous, they can feel that from you.
Oh, they're like dogs.
So if you're still not comfortable and you still have all these questions, what you can do is you can probably call your dental office and say you want to talk to a nurse or the dentist, whomever's available, and talk to them about this, because you're going to be much better, and then your kids are going to respond better. Then the other thing I'm going to say is, when you do go, just be supportive. Don't try not to get in the way, because they know how they're dealing with these things. They know how to make her less nervous. So just try to be there for support, to hold a hand if they let you in the room. Some offices do let you do that. Some offices don't. I mean, technically, we're not supposed to have parents in the room because there's bacteria flying when we're doing treatment. So I do understand when offices opt not to do that. Then the other thing is, make sure they're fed when they go, because everybody knows that a fed child is a happy child. So eating is good. Make sure you talk about it. You're not going to talk about, needles and scary thoughts, and no, just, we're going to go to this office. You have cavities. Cavities are holes in your teeth. Your teeth are sick, and we need to make them better because they're going to hurt one day. So can we wait? Everybody wants to ask me, my child has cavities on baby teeth.
They're just baby teeth. Let's just wait until we get adult teeth.
Wait?
Is that the right way?
The answer to that is most times no. So there's different things. How large are they?
Yeah.
Are they on the outer coating of the tooth or the inside of the tooth? When they're outside, they're slow growing. So sometimes, and this depends on your child and their nutrition, if they're eating well, if they're brushing twice a day, if they're flossing, sometimes we can make that process slow down.
Yeah.
So, that's a conversation with the doctor. How big are they? Are they baby teeth or adult teeth?
They don't come out till kids are 11, right?
Exactly. That's the other thing. Some of these teeth, when are they actually going to exfoliate? When are they actually going to come out?
So these teeth come out faster.
These come out 6 to 7 years old. The molars, they can be 12, 13 before a tooth comes out. So can you wait? Your child is 8 years old. Can you wait? No, you can't wait. Okay, it's very important that you treat it. If you don't treat it, they can end up needing a baby root canal, a crown, a silver crown.
Oh.
The tooth may have to come out. If the tooth comes out, what happens is the space over time closes. They're 8 years old. They're going to need that space to maintain your teeth shift. So now we're having to put a space maintainer on the space to try to hold it. So it's not ideal. It's not. I mean, it's at the end of the world.
So Heather's already there. Heather already has daughter, and she